Hello everyone, Sam here from Mind Body Medical. I hope you guys are all well. I hope you're enjoying the lovely hot weather we've been having, which has been a nice change. So last week we put up a post asking for people to request what kinds of ailments you guys would like some help and advice around managing using really effective evidence-based natural medicines and herbal medicines. And that post we had just dozens and dozens and dozens of comments. We had private messages, emails, and there were about 25, 30 different kind of requests where there were a lot of commonalities. We picked the top three. We picked the top three ailments that were listed in those 70, 80 comments. They were osteoarthritis, managing anxiety and kind of stress, and managing fatigue, chronic fatigue syndrome. So they're the three ailments that we picked, and over the next 2 weeks, we're gonna do a live session like this, which will be uploaded to our YouTube channel. And if you're on our mailing list, we'll email it out as well. So if you're someone that's asked for help with those three, these sessions are going to be about, 20 minutes long, 25 minutes long, and they're going to provide a really in-depth overview, the kind of approaches that we use in our clinic when we're managing these kinds of problems. Evidence-based, safe, incredibly effective, okay? So this content comes pretty much, so we have an online course called the Hobby Herbalist, which is all about, it's a 6-week course, 2 hours a week for 6 weeks, which is all about, the whole aim of the Hobby Herbalist course is about equipping people with the knowledge, the confidence, the competence they need to become really expert at using herbal medicines to manage and prevent common household ailments. And this is the kind of thing we cover. That course starts in a couple of weeks. It kicks off on June the 15th. It's currently 50% off at £45 for the whole course, all the sessions, all the workbooks, recipes, remedies. So if you're interested in learning more about how to become a confident and competent home herbalist, then check out the Hobby Herbalist course. It starts on June the 15th, and it's getting full up, so do check that out. So osteoarthritis. So osteoarthritis, if you look at the public health evidence, is one of the most common problems to be affecting the over 50s and even younger than that in Britain and most of the Western world. It's an incredibly common problem, and it's essentially labelled as a degenerative condition. So it develops when the joint capsules of the body, typically the knees and the hips, also the elbows, the hands, the feet, the tissue in the joint begins to break down. It causes pain, it causes inflammation, it causes stiffness, it causes immobility. And at the more extreme end of the spectrum, it can be really life-limiting. It can reduce our ability to get in and out of the car, in and out of baths, the ability to open doors and tins, and the ability to do hobbies like painting or knitting, just to be able to use our fingers, do up buttons or things like that. So on the one end of the spectrum, it's kind of a bit of a nuisance. On the other end of the spectrum, it's really life-limiting. But the key thing is that the evidence around the ability to intervene, not just to alleviate the symptoms of arthritis, but actually stop and reverse it, to actually reverse the damage that's causing the problems, is incredibly strong. The mechanistic evidence around how we can use herbal medicines and compounds to address arthritis is so strong. And actually, so in our clinic, from our audit, so every year we have to review kind of our outcomes for different ailments. Osteoarthritis is, year after year, the ailment we have the most clinical success with. We're well over about 85%. Not because we're doing anything special, just because we're tapping into this very evidence-based model. And if we're doing that, the mechanisms around how these treatments work in the body are so strong that it can't really do anything but work. Okay, so if you're suffering with osteoarthritis, or a loved one, neighbor, friend, family member is suffering with it, please let them know that you don't need to kind of suffer in silence. It's about changing our expectation. The old model is this view that osteoarthritis is a natural product of life. It's something we've got to get on with. Stiff upper lip, just grin and bear it. There's nothing we can do. That's such an outdated, inaccurate view. The evidence is very clear that we can very powerfully reduce the severity of the symptoms, stop or in most cases slow down progression, and very often reverse the severity of the problem. So this is something that we can take control of. We can take the bull by the horns. We can dominate the situation. And this is going to provide, over the next 15 minutes, an overview of what is the core treatment for doing that. If someone comes to us in our clinic, what do? This is what we do. Okay, there's lots of other things, but this is the foundation of it. Okay, so this, generally speaking, when you're managing these kinds of problems, the key thing is you need to triangulate. Okay, if you just use one treatment, you'll probably get a significant effect. If you use 2 treatments, you'll get a bit more of an effect. If you use kind of 3 or 4 treatments, you get an exponential gain. It's called herbal synergy, which is where the whole is greater than the sum of the parts, or it's often referred to as 1 + 1 = 3. It's where the total is more than the sum of the parts. Okay, and that's absolutely true when it comes to osteoarthritis. You can't just go to the health food shop and start glucosamine or start turmeric. It's definitely going to give you a gain, but nowhere near what you should be getting. Okay, so what I want to talk about is the strongest kind of form of treatment, which is the tinctures, the supporting treatment, which is the herbal teas, and then a topical treatment to alleviate the pain from the outside in, and also a singular supplement. Okay, so these are the foundations. So firstly, the tinctures are kind of, I guess, almost like the pharmaceutical equivalent. These are the ones that pack the real punch, really strong, evidence-based, tested. Okay, and this is by no means exhaustive. There's lots of variety here. There's about 7 or 8 herbal medicines that have been clinically trialed, that have been tested, that are effective. The 4 that we're going to talk about are the 4 that are our preference, one based upon the strength of the evidence, and secondly based upon our experience of using them in clinic and seeing which ones are most consistently reliable and consistently predictable in terms of their effectiveness. And the 4 herbs that we need are turmeric, Boswellia, nettle, and ashwagandha. Okay, why those 4? So to have success with managing osteoarthritis, there's 2 key areas we need to target. The first area is we need to very powerfully reduce inflammation and reduce the pain pathways, because what is it that makes arthritis a nuisance is because it's painful, okay, and it's inflamed. So to get to the root cause of the problem, to become curative, we need to reduce inflammation in the joint and we need to reduce the pain. So that's the foundation. The second thing we need to do is we need to make sure we're clearing toxins effectively. If we've got lots of things like uric acid, people think of uric acid as being the cause of gout, but toxins also form and are deposited in the joint for things like osteoarthritis, which can really exacerbate the symptoms. So we need to make our body into a really effective toxin clearing machine. So all of these toxins that exacerbate the problem are being cleared effectively. Okay. So the most important, the mandatory herbs, I don't think we can get the success we need without these 2 herbs, is the turmeric and the Boswellia. Why those 2? Firstly, the Boswellia. So Boswellia is a gum. It's a gum, like a gum resin that comes out of the Boswellia tree. It's incredibly strong. And the reason it's so powerful, and we never manage pain or inflammatory conditions without using Boswellia, is that it's clinically proven to block a compound in the body called lipoxygenase 5. Lipoxygenase 5 is a pain and inflammatory pathway. So when you're taking drugs, steroidal treatments, non-steroidal painkillers, the reason they work is because they sever the lipoxygenase 5 pathway. If you block that pathway, inflammation drops and pain gets better. Okay, Boswellia, there's a compound in Boswellia called boswellic acid, which is clinically proven in an incredibly robust way to powerfully sever that pain and inflammation pathway. Okay, and it does it very, very quickly. So by taking Boswellia, within about 7 days, your pain pathways, your inflammatory pathways, the compounds that are responsible for those are 7. So in our experience, within about 7 to 10 days, people are noticing a really significant difference. Their pain is better, they're sleeping better, their mobility is better, they're getting out of the bath more easily, their hand dexterity is improving because you're blocking that compound. Secondly, turmeric. And your most health conscious people know about the benefits of turmeric in so many ways. It's anti-cancer, it's heart disease preventing, but it's one of the most proven and powerful anti-inflammatory compounds in the whole of the natural world. Why? Because it contains a compound called curcumin. Curcumin is what gives turmeric that bright or orange colour. And turmeric is a clinically proven anti-inflammatory, it's a clinically proven painkiller, it's a natural affinity for the joints, clinically proven to reduce the symptoms and severity of osteoarthritis. It's been shown to help the joint capsule regenerate. So if you have turmeric on its own, you get a big effect. If you have Boswellia on its own, you have a big effect. If you combine them, magic begins to happen, okay? So, and those two, I think, are mandatory. They are absolutely essential. Using it in concentrated form. You can obviously add turmeric into your cooking and into drinks and things like that, but we also want it in concentrated form. So you've got your Boswellia and your turmeric. The second two, nettle and ashwagandha. Why those two? Nettle, because it's brilliant. It's a very, very powerful anti-inflammatory. It helps to clear toxins. It's a detoxifier and it's a diuretic. So it helps flush uric acid, crystals, compounds from out of the body via the kidneys, okay, as urine. So, and there's been clinical trials done just looking at nettle. And people taking nettle tea, nettle capsules, nettle tinctures showed about a 75% improvement in their arthritis symptoms within 6 weeks of just using nettle. Okay, you add that into the combination prescription, the gains become even higher. So nettle is incredibly effective. And lastly, ashwagandha, because it has such a natural affinity for the joints. Okay, again, a clinically proven anti-inflammatory. It's a lubricating, nourishing, soothing herbal medicine. It helps to lubricate the joints. It helps to increase fluidity in the joints. It reduces friction in the joints. It's a painkiller. It's an anti-inflammatory. So every one of those 4 herbs individually has a clinical evidence base to support effectiveness. Together, they're profound. Okay, so they're the 4 herbs you want to be using: ashwagandha, nettle, turmeric, and dandelion. Ashwagandha, nettle, Boswellia, and turmeric. You can get those in capsules. You can get them in tinctures. We prefer tinctures because they're easier to blend and quicker to take, and they're stronger. But you can get them in any way. You can go out and pick nettles. You can forage for nettles and make nettle tea. So there's lots of ways of using it. The second thing are herbal teas, and so this is that synergy. By using the strongest treatment, you get an effect, but by supporting that treatment with a kind of a complementary tea blend, that supports the efficacy of that. You get a bigger gain. I remember going back a couple of years where we were using this because we couldn't get these ingredients in from our dispensary. We were using that, and then we got this in this given patient, and by adding that in, we got about a 30% additional benefit within about 2 weeks of adding that to that, okay? And again, there's lots of herbs that you could use in a herbal infusion for osteoarthritis. The ones we prefer are equal parts dandelion, nettle, echinacea, and ginger, okay? People think about echinacea as being obviously the infection fighting herb, great for preventing colds and treating viruses and things like that, which is amazing at. But it's got loads of other benefits, one of which is that it's a very, very strong anti-inflammatory that has a particular affinity for the joints and osteoarthritis, and it's clinically proven. There's clinical trials done looking at the effects of echinacea on osteoarthritis, really good outcomes. And it's also just a good kind of full body tonic. Okay, so echinacea, we've spoken about nettle, we've got nettle in here, nettle in there. The other two, dandelion, because it's another great detoxifier and anti-inflammatory, And lastly, the fresh ginger. Ginger is a really, really strong anti-inflammatory. So they're 3 dried herbs: nettle, dandelion, and echinacea. You then add the fresh ginger into the cup, not into there, because the ginger is obviously wet. It's going to putrefy and mold if you add it into that blend. Okay, so you have the 3 dried herbs and the fresh ginger. In terms of sourcing those herbs, they're really easy to get now. If you go onto companies like Baldwin's, I'll post the link for these in the comments below once I've finished. But there are companies like Indigo Herbs, Napier's, Baldwin's, Organic Herb Trading, Star Child. There's about 7 or 8 brilliant online dispensaries where you can buy organic, licensed, certified herbs. Okay, you can get the dried herbs, you can get the tinctures, you can get the capsules, you can get the powders. You could probably have all of this stuff in your house by Friday if you ordered it today. Okay, so the mainstay is those 4, supported by a combination tea of nettle, dandelion, echinacea, and fresh ginger. Okay, you want to be having about 2 to 3 cups a day of that, morning, afternoon, evening. Okay, then the last oral treatment, so that's the triangulation. Powerful herbs, herbal infusion, capsules. The last kind of oral treatment is something called MSM. Okay, MSM, which is a sulfur-based compound. Our body produces MSM and sulfur naturally, but MSM is a concentrated form of sulfur. Or methyl sulfur. It's a slightly different form of sulfur, but if you go online and Google this, the clinical evidence for the effect of MSM on joint problems, not just osteoarthritis, things like tendonitis, bursitis, things like that, is absolutely profound. Within about 6 weeks of taking MSM, people are noticing 60-70% improvements in their symptoms of osteoarthritis. So this is clinically proven, that's clinically proven, that's clinically proven. You do just one, you get a gain. You do all 3 together and suddenly things become game-changing really quickly. Okay, so they're your internal, your oral treatments. The final piece of the puzzle, which I don't think you can kind of afford to miss out, is the topical treatments. So these are working from the inside out. You also want to work from the outside in, so the 2 join. Okay. There are quite a few different options here, but the number 1 treatment, without exception, is a famous Ayurvedic, incredibly strong herbal medicated oil called Maharanan oil. Okay, and again, I'll post in the comments how to spell that and where to get it from. You can get it online from a company called Essential Ayurveda up in Lincoln. Brilliant company, but Maharanan oil is made up of dozens and dozens of herbs. Okay, and it's so concentrated. So to make 100 mils like that, you have a huge vat of herbs, and you boil it, you simmer it down until it's this super concentrated, incredibly potent medicated herbs. And the herbs that go in that are all joint supporting, anti-inflammatory, and pain alleviating. With absolute sincerity, we've had people come into our clinic, not as patients, just as people who we've recommended this to. They're not having any of this, they're just using this. And they come back in, a couple of weeks later and say, what is this stuff? I can't believe that by rubbing this into my knee or my hand twice a day, suddenly I can do X, Y, and Z, which I couldn't do before. We've had people be able to get upstairs more effectively. We've had people be able to hold their golf clubs more effectively. It's hard to overemphasize the significance of Maharanan oil when it comes to osteoarthritis and pain and joint problems. It's one of the most powerful classical Ayurvedic medicines for osteoarthritis. Obviously, turmeric and Boswellia are Ayurvedic herbal medicines. But this is just kind of a wonder treatment. And all you need to do, you don't want to dilute it, you don't want to use it, you don't want to mix it with a carrier oil, you want to use it completely neat. Okay, so all you want to do is get about a tablespoon. It depends how much of your body, if you've got arthritis in both knees, both hips and both elbows, you're going to need to use more oil. But generally it's about a tablespoon per joint, I would say. So all you want to do is get a tablespoon, warm it up. It's really important that it's warm. You don't want to use it cold. You could do that over a candle burner. You could do it on the hob, or in a saucepan. Don't do it in the microwave because it destroys the compounds. And all you want to do is you want to just then massage it into your joint. But the key thing is you've got to put a little bit of elbow grease in. It's no good getting the oil, giving it a cursory rub in, and then being on your way. It's not going to work, because the reason topical treatments work is something called transdermal therapy, which is the way medicated compounds travel into the body through the blood vessels and nerves in the skin. In the same way that HRT patches work, or morphine patches. How do they work? They work through getting into the body through the skin. This works in exactly the same way, but for it to work, you've really got to get it into the pores. You've got to work it into the joint. So once you've covered the joint, you want to spend a good 5-10 minutes really with 2-3 fingers working it into the joints, not just on the joint, but all around the joint. Okay, really working it in. The longer, and also people are usually very inclined to do that, because if you've got arthritis and it's sore or painful, massaging in a hot oil it feels really nice. It's immediately pain alleviating. So people often don't struggle to do that. So you really want to work it in. You want to do it at least twice a day, more often if the arthritis is worse, but the really important one is before bed. Okay, because if you cover the joint in maharan oil before bed, really work it in, and then obviously you're not showering, you're not sweating as much because you're going to bed, you're not doing as much. It works all through the night to help repair and support that joint. Whereas if you do it in the morning, you're sweating more, so more oil is pushed out, you're moving your joints, it's got more work to do. At night, you're resting, you're healing, it becomes more effective. So as a minimum, I would say massage it into the joint in the morning and in the evening. But if you can get a third or fourth application in during the day, you're going to get an exponential benefit. Okay, so it's really hard to overemphasize the significance that Holly and I have seen this have in both patients and non-patients over the years. It's phenomenal. So if you add those 4 in, then all of a sudden the whole biochemistry of your body, the whole physiology of your body, all of the inflammatory pathways, the pain pathways, all of the things that are causing the problem are being inhibited and impaired, so we feel better, whilst we're putting in compounds into the body that actually help to repair and rejuvenate and restore the functional integrity of the joint itself. You add those two things together, and suddenly you can see why the evidence is so strong, and why within 5, 6, 7 weeks you can see these 60, 70, 80% gains. And I say that with absolute sincerity. We've seen people transform their ability to do things that they couldn't do because of osteoarthritis using these kinds of approaches, because it mechanistically works at the biochemical level, at the physiological level. Okay, so really hard to overemphasize this. You don't need to suffer in silence. If you've got arthritis and anyone has told you it's a byproduct of aging, you just got to kind of suck it up and get on with it. That's not the case. We have the capacity to massively impact upon how bad those symptoms are and how much we impact upon those. And to my mind, this is the way to do it. There's lots of other things that are important, things like omega-3. Omega-3 supplements have been shown to induce really good gains, or eating lots of omega-3 foods, things like glucosamine, super easy to get from a health food shop, big gains, but they're on the periphery. These are the foundations, okay? So the concentrated herbal medicines, the supporting tea, the MSM, and the maharan oil. If you've got those 3 or 4 supporting your body, I would bet my bottom dollar you're going to see a significant improvement. It might be a smaller improvement, or it might be a massive improvement, but you're going to see an improvement, okay? Like I say, we'll be covering all of this in much more detail on the Hobby Herbalist course. We talk about dosing and blending and medicine making, and so every week on the course we cover a body area. We cover the musculoskeletal system, the hormone system, the respiratory system, the immune system. We talk about what are the things that are most likely to go wrong, and how do we fix them? How do we prevent them using herbal medicines in very detailed protocols? So if you're interested in learning more, do check that out. Like I say, it's currently 50% off at £45. So But any questions, once I finish this video, I'll post up all of the links to the dispensaries and the suppliers and how to spell all these things. Any questions, let me know. But other than that, have a lovely rest of the week. Enjoy the beautiful weather. Although it's just started raining here, so forget that. And I'll see you all soon.